We are very pleased to announce today that the St. Luke's Healthcare Foundation will be donating 50 automated external defibrillators to the Cedar Rapids Police Department. This really represents our investment in continuing to make this a heart-safe community. This donation totals nearly $70,000, and that will allow us to outfit every patrol car in the city of Cedar Rapids with an AED.
The Cedar Rapids Police Department has a very comprehensive medical emergency plan. When police officers arrive, they're generally the first ones on the scene prior to an ambulance or the fire department getting there. So us having this technology and the ability to apply these devices to people who are in need of them is monumental in the ability for us to save more lives. So we're very excited that we were able to get this donation from St. Luke's. We're very excited about the partnership and the commitment to save our community.
When I heard that we were going to have 50 more defibrillators on the streets with every officer, you know, that meant something to me, because I am proof that those things are needed. And assistance with my daughter with the CPR, then Officer Bolshanellik there, that entered our home there. Annette, I just think what you're doing here is just really great, Annette, and I do realize it's not just for the Cedar Rapids Police Department. Your gift is to the community. And St. Luke's, we thank you very much for that, Annette. And my wife will say a few things here.
A little bit about Terry's story. Excuse me. It was on November 23rd, 2007. It was Friday morning after Thanksgiving. We were resting in. Some of us were resting in. My husband had been up through the evening with his daughter, Erica, our daughter, and he wasn't feeling well. They had done numerous things, and it got to be about 5:45 on Friday morning. Terry told Erica he wasn't feeling well. He went right down there on the kitchen floor. Thank goodness we had a witness. My daughter was right there. She immediately called 911, immediately started CPR. And at that time, we're thinking, okay, how are we going to do this? She's talking on the dispatcher, and we're thinking, oh my goodness, this isn't going to work. I saw his head turning blue. I'm thinking, oh my, how is this going to happen? And then, out of the corner of my eye, I saw Officer Frank Bolshanellik standing in the corner of my kitchen with the defibrillator. And I knew then that he was our beacon of light. He came, and his defibrillator is what really helped to assist Terry to be here today. He's a survivor because of this. And this donation means so much to our family. You know, you always think it's never going to happen to you. We always said it's not going to happen to our family. He was 54 years old, 53 years old. It just doesn't happen, but it did happen. And because of this donation, there are so many more community people here in Cedar Rapids who has the opportunity to have this happen for them. And at this time, I want Officer Bolshanellik to come up here. We agreed to do this because we wanted him to be recognized for his work and using the defibrillator. Thank you so much. I do appreciate it.
Well, I didn't think I was going to say anything, but I guess I'm stuck. These AEDs are a godsend. I don't think we use them as police officers as often as we used to, because area ambulance uses a dynamic system status method for deploying their ambulances, so they're actually on scene a lot faster than they were when we first got them. But when we first got our AEDs, it was within the first couple of weeks that we had our first save, and I don't even know how many we've had since we've got them, but I'd sure like to know. This is just one example of many of them, and as a police officer, I greatly appreciate the fact that St. Luke's has
continue to tell me those tasks until it's completed. Very, very simple. When we first find a patient, we're going to remove the clothing, and we just have to open the lid. You'll notice it does a quick self-test. They're constantly testing themselves as well to make sure they're ready. And there's a set of pads up here.
Peel one pad from plastic liner. Place one pad on bare upper chest.
So bare upper chest, I just look at that picture and match to the bare upper chest.
Place one pad on bare upper chest.
So I'm going to place that on this victim exactly as it's showing me.
Place one pad on bare upper chest.
Like so.
Peel second pad and place on bare lower chest as shown.
So we do Feel second pad.
Feel second pad and place on
The very lower chest, which is right about there.
Do not touch patient.
And once they're on,
Analyzing rhythm.
now I can just kind of stand back. This is the whole
Do
listen.
not touch patient. Now safe to touch the
It
patient.
tells me it's safe now. It's safe to be near the
Start
patient.
CPR.
It directs me to start CPR.
Give 30 compressions. Then give 2
And it
breaths.
gives me instructions on how to do that. It even gives me a beat to match with, to make sure I'm doing high quality CPR. So I just match my compressions with those if you're touching the patient or not. So you might think, well gosh, what if someone was still touching the patient and it's shocked? It knows that. And so if it was saying, reinitiate that. Very safe, always ready. They do continuously monitor themselves. So if anything were to go wrong, these pads here, after a couple of years, there's something inside the machine that were to break, it would tell you that. So it actually alarms, beeps, and tells you that. So you know all the time what's ready or what's going to happen. And something we're going to